Hi, welcome to Hive Medical Academy's another series of webinars. And today's webinar episode is about specifically for the PLAB2. We're going to start in 4 minutes time, but before that, we have got Dr. Omar, who is academic lead of Hive Medical Academy, and he's going to share about his services, what Hive Medical Academy is offering, and they have got some smart prep bundles, and they have lots of offers for the PLAB candidates. So over to you, Dr. Umar, if you share about
Thank
your
you.
website and your
Thank you,
services.
Dr. Skill. Yes, thank you. Before we start into the main topic of the webinar, I'm just going to share my screen and just take you on a quick tour of our website. So, Dr. Shakil, can you just confirm you can see the website page there?
Yeah, yeah.
Fantastic. Okay, so as you can see, when you go to the home page, this pop-up comes up, start your free PLAB 1 and 2 trial now. So if you're interested in a free trial, you can click enroll now, but we'll come back to that later. There's some picture of some gentleman there. I'm not sure who that is, who's going to be featuring in all the courses. Okay, so as you can see on the main page, you can see stuff about PLAB2. You can see the dates of our batches for PLAB2, our Global Medics NHS program, which is our all-inclusive program, which takes you from your home country to your first NHS job. Another picture of this strange gentleman on the home page. I'm just going to quickly show you our PLAB 1 and 2 offers. So if we click on PLAB 1, let's hope the website and my internet connection doesn't let me down. Okay, that's good. Uh, as you can see, the free trial props up again, just in case you're interested. So our top PLAB 1 package is the PLAB 1 Premium. In this, you'll get 24/7 support, live teaching sessions, video course, 10 mock tests, 5,000 MCQs, audio course as well, 250 digital flashcards, and you can opt for the free trial at the bottom there. But we also offer smart prep bundles, which are designed if you feel you don't need the full package. You can choose to purchase 10 mock tests. You can choose to purchase 5 mock tests or 3 mock tests, or you can opt for a 2-day booster course, which is live teaching, and you can explore these pages there. Moving on quickly to PLAB 2. So in our PLAB 2 offers, you'll be able to see again our top. There's the pop-up again. Our top package offer is the PLAB 2 Premium, which includes 10 days face-to-face teaching in our academy with all the usual stuff you'd expect, SimMan, mannequin practice. But in addition to that, and in addition to things like 2 live timed mock tests, full exam conditions, you get access to our online course. Online course includes video lectures, audio lectures, uh, around about 1,000 revision, 1,000 flashcards featuring clinical flashcards, data gathering, differential diagnoses, cases, mock cases, practice cases, explanations, information on procedures, examinations, and nice guidelines. Again, you can opt for the free trial if you want to do that, but we have other offers as well. We have the online course only. Perhaps you're doing preparing face to face with somebody else, no problem, but you want some extra preparation, or perhaps you don't, you want to explore the online thing before you commit to a face to face course. So we have the online course on its own available, and we also have the smart prep bundles available, which kind of split up the premium package. Basically, you can have a 10-day package, a 10-day face-to-face course on its own, or if you feel you don't need 10 days, you can do 2 days or you can do 5 days. So there's lots of choice. And very briefly, before I hand back to Dr. Skill, what I'm going to say about our PLAB packages and our PLAB resources, what makes us different is our support, the fact that you will have access to myself, Dr. Shakil, other senior members of the team throughout your journey. We can make things personalized. You know, if the packages, we have a lot of packages available, as you can see. If they don't suit you, you want something bespoke, we can do that as well. And the final thing is, you will be prepared directly by myself or Dr. Shakil, people who have either been through the journey or examined and worked in the NHS, for many, many years. You'll find nobody giving you a keynote lecture and then handing you over to somebody who's recently passed PLAB. We don't work like that. You will get direct teaching and observation and feedback from the most senior members of the academic team. The final thing I want to say is we also, our journey doesn't just stop there. Neither does yours and neither does our support. Our journey continues after PLAB. So what do we offer after PLAB? Because obviously finding a job can be difficult, can be challenging. It can, there's lots of things that you need to do in order to increase your chances of finding a job. So what kind of things do we offer? We can offer you CPD courses, continuing professional development courses on things like audits, appraisal, which, and how the NHS system works, portfolio, all that kind of thing, which prepare you for practicing in the NHS as well as improving your CV. And coming to the CV, we also do a full review and usually multiple reviews of your CV to get it into the best condition possible to make sure that when it goes in front of somebody, you get selected for the interview. And then after that, of course, the third thing is that you will never have had an interview, perhaps in for an NHS job before or with a fully English speaking panel before. I'm not sure. This could be lots of things that are new for you. We will do mock interview preparation sessions to help you prepare for that interview, which is your chance to sell yourself in front of the people who are going to be looking at employing you. So that's just a quick tour of our website. Before I hand over, just to remind you that there is a free trial available. So if I just go back to the home page, it will come up. If you're interested in having a look at our course offers for 72 hours for no charge whatsoever, just to get a taste of what's included, then just visit the website, click enroll now, follow the steps, and take a look. Back to you, Dr. Skill.
That's great, and thank you so much, Dr. Umar, for taking us through the website too. Just one more thing, I believe Hive Medical Academy has got some specific partnership with the different hospital and surgeries where we provide clinical attachment. So could you just tell us a bit more, and then we'll start the webinar? You
Yes,
have a
that's right.
clinical
Yeah,
attachment page, yeah?
yes, that's right. Yeah, I forgot one of the most important parts of your post-PLAB journey, which is actually doing a clinical attachment or an observership program, which everybody usually knows as attachment. So most of the time, these can be very difficult to come by, long waiting lists, particularly in hospitals. However, at Hive, we've partnered with some GP practices in our area to bring you some training practices who are very, very used to training GPs, foundation year doctors, and specifically IMGs, international medical graduates like yourselves, giving you a taste of the NHS, giving you an induction into the systems, the procedures, the culture, the workplace culture, the teamwork, and giving you an overview of how primary care interacts with secondary care and all of the other things that you would expect from a clinical attachment to actually get you face to face with real patients, seeing them, speaking to them, examining them, and being involved in their care, ideally before you sit PLAB2, because then you will be even better prepared for your PLAB2 exams. If you've already done your PLAB2 exam, it's no issue. You can still do it afterwards, but ideally it will be better before your PLAB2.
Sounds great. So if somebody wants to apply for the clinical attachment, they are back in their country. So how they can approach from our website?
Yeah, so again, from the home page, you just hover over courses and then scroll down to clinical attachment. And what you will see on that page is details of our clinical attachment, what you get. There's Dr. Reese, who's our clinical attachment lead. Some details on one particular practice, but there are many practices involved. And then if you scroll down, all you do is you just pop your name, your email address, your number, answer the questions about whether you've passed PLAB 2 or not, and when you're interested in starting a press submit, and someone will get back to you.
That's perfect, and that's very simple and straightforward because there is a 6 to 12 months waiting time. And I have spoken to several doctors; they could not get the attachment during visa period. Their visa expires. Thank you so much, Dr. Omar, for taking us through everything which any international medical graduate needs for his PLAB journey to start his career in the UK. So let's make a start for the webinar now because we have got his 6 past 2. We're slightly late. Let me share my presentation. Right, thank you so much everyone for joining Hive Medical Academy's webinar today. Today's webinar is specifically about the PLAB 2. We're going to share everything about the PLAB 2 you need to pass your exam. Uh, who we are. Hive Medical Academy is one of the best academy in the UK, established by the doctors, all the professionals, and AMEs to facilitate, support, and empower international medical graduates. Me myself is an international medical graduate. I started my PLAB journey and completed several years ago. I did all my training in the UK from junior doctor to consultant to spend 22 years in NHS, then been moved into full-time medical education. So at High Medical Academy, we put all the international medical graduate at the center of everything. We know what are the requirements, what are the hassles, and what they need to make their journey successful. Hi, today's PLAB is seminar is about how you could crack your PLAB 2 with confidence. And we're going to guide you step by step. What is PLAB 2 exam? What's going to happen in PLAB 2? And how you could pass and how High Medical Academy will help you to smash your PLAB 2 in first attempt. Right, the learning objectives are like any other session you get, you have some learning objectives. So we think, and today you will know about the PLAB 2, what's the structure, what's the format of PLAB 2, what's included in the stations, what sort of the stations will be there, what are the essential competencies being tested by the examiner, what's the GMC looking for as communication, reasoning, and professional ethics, what's more important, and what's the marking scheme. You need to understand about common challenges for the international medical graduates because this is sort of the different exam. Are you moving to different country, different healthcare system? So you need to understand all those challenges and how you could overcome and how High Medical Academy will help you to overcome all those challenges and difficulties. We will help you to prepare for the exam and what are the proven methods and what are the proven strategies, what are the best resources, including your mock OSCEs and practices and other feedback tools which could be used to smash your PLAB 2. Step-by-step personal preparation plan for every international medical graduate. You will, after this session, you will be able to understand how you need to plan your journey, what you need to for the PLAB 2 exam. Brief about me, originally international medical graduate from Pakistan, graduate from NISTA, moved to UK, completed all training here, been education supervisor, clinical supervisor, and have been mentor for AMPs, foundation doctors. I worked 22 years in NHS, then full-time in education. We have got Dr. Umar, graduate from Liverpool University. He's a local born and bred in UK. He has got almost 20 years of experience, clinical experience. He's been education supervisor. He has been mentor for pharmacists. He's been tutor in Manchester University. He's our academic lead. He's been OSCE examiner as well. So he knows what you need, what the examiner is looking for the PLAB2 exam, and we make sure you pass your exam in first attempt. Right, this is the bit intro. I'm going to pass word to Dr. Omar Rest to start and take you through the PLAB 2 journey and see how it goes then. Over to you, Dr. Omar.
Thank you, Dr. Skill. Welcome, everybody. Good afternoon, good evening. I think it's probably evening for most people who are joining. I'm just going to share my presentation, so it's just easier. Otherwise, we'll have to get people to change the screen. Okay. Right. All right. Great. Dr. Q, please confirm
Yeah.
that it's visible. Right. Okay.
Yeah.
Just before
Perfect.
we start, what time is it now? It's 10 past, almost quarter past 2. So I'll try to keep myself to 30, 40 minutes maximum. If I do waffle on, please just send a message in the chat box and say, can you move on? Please use the chat box to post any questions, share anything anything you want to answering, any concerns, any queries. But before we start, it'll be nice to know who is here and where you are from. I recognize some people. Dr. Shahid, I think welcome. Dr. Shahid is one of our PLAB candidates. He passed the PLAB 1 very recently. He's preparing for PLAB 2. Dr. Rohab from our team. I think Dr. Janjua is here from as well from HBS Medical School. So a few names I recognize. But if you wouldn't mind, please drop in the chat box where you're from, which city. It's a good way to just have a bit of an icebreaker, and then I can get an idea of where people are joining from. That's if I can get my chat box on my screen, which maybe technically I'm not the best. Here we go. Okay. Everyone's being very shy today. Okay, thank you, Muzammad Ahmed from Islamabad, Pakistan. Thank you very much. We were in Islamabad recently. We were in Pakistan in April. Lovely weather. It's probably quite hot there now. There you go. We're in Manchester. Anybody else? Please share. Okay. Looks like everyone's either being okay. Dr. Shahid Gujarat, thank you. Dr. Abbasi from Manchester. Okay, welcome. Local. Gujarat, we also visited recently on our Pakistan tour. We went to Aziz Bhatti Shaheed Memorial Teaching Hospital with Dr. Shahid and his team. Great work being done there by all the staff in the hospital. Very inspiring. Okay, so far everyone is either from Pakistan or the UK. Anybody from our friends and neighbors in India or Bangladesh? Okay. While you guys are thinking about whether you're going to reply or not, I will start my presentation. Okay. All right. So let's crack on. Aisha Batul from Islamabad. Welcome to you as well. Beautiful place, Islamabad. One of my very favorite cities. All right. Welcome to everyone. Thank you for joining. So PLAB 2 is a OSCE examination, objective, structured clinical examination. Okay, this is held by the GMC in the Manchester Test Centre. Now, you guys, some of you are definitely postgraduate because I recognize that. I don't know if there's any medical students around, but OSCEs you should be familiar with OSCEs. You might not be familiar with the exact format, which we'll speak about later, but you should be familiar with these kind of examinations where you will do either a short case or a long case, as they used to be called in the olden days. And then when medical curriculums were modernized, which has happened in India and Pakistan now as well, there became OSCE examinations, which are very, very focused. So they're testing certain competencies in certain areas of the PLAB curriculum. So the format is 16 stations. It's 18 in total, 2 arrest stations, and you have 8 minutes each. Very pressured exam, 90 seconds to read the scenario outside the station, then 8 minutes to go in, introduce yourself, speak to the patient, take a history, do an examination, take a psychosocial history, do ICE, think about the differential diagnoses, communicate them with the patient, come up with a management plan, negotiate that management plan, and then close the station, or possibly even speak to the examiner if they ask you something. So 8 minutes is very pressured, and you need lots and lots of skills to be able to complete this examination satisfactorily. Test your practical skills, communication skills, and it measures basically whether you are ready and safe to practice in the NHS. It's not purely a test of knowledge. PLAB 1 tests your knowledge or your application of knowledge. It does test some knowledge, but more so it tests your communication skills, your interpersonal skills, your ability to do a consultation satisfactorily, your ability to approach things holistically, negotiate with the patient, and bring the case to some kind of conclusion. Okay, so what kind of stations might you get in the PLAB2 exam? So we've already mentioned some of them. History taking, where you need to take a history, something you should be extremely good at least from a medical point of view. Doing a physical examination, usually focused, and even the history is going to be fairly focused because it's very unlikely for you to just get a history taking station or just get an exam station if you are with a real patient. Sorry, with a simulator. So you're going to have to do a bit of both in one station. What else can you get? There are stations which will test specific types of communication skills, your ability to explain a procedure, counsel a patient regarding, a pre-op or post-op, or explain to them some results, explain to them the colonoscopy, what's it going to be like, what are they going to go through, what's going to happen pre-procedure, during the procedure, after the procedure, address their concerns, etc., etc. You might get a station, some stations where you have to motivate the patient. You have to, speak to them about their lifestyle, give them some lifestyle advice, encourage them on healthy living, exercise, diet, stopping smoking, reducing their alcohol, whatever. Again, these are going to form, these will be the main kind of things that are tested in these stations, but they will form part of a kind of broader test of your consultation skills. You're going to face challenging scenarios with actors. You might have to break some bad news to a patient. You might have to deal with an angry patient. You might have to deal with a difficult or an angry colleague in a scenario. So these kind of things can come up as well. Ethics and professionalism is going to feature heavily in these stations. In fact, really, there's going to be some elements of this in all stations. So, you're not going to get a station just on consent or just on capacity or just on confidential. There's going to be elements of these in all the stations. So ethics and professionalism is extremely important for the PLAB2 exam overall. And then, of course, there are procedures. So things like cannulation, catheterization, venipuncture, arterial blood glasses, and even certain, examinations like doing a bimanual examination, taking a cervical smear, etc. So there's other types of stations as well. So there'll be stations where you're interacting with a simulated patient or an actor. There'll be stations where you are doing that and then doing an examination on a model or a mannequin. And then there will be stations where you are just dealing with a model or a mannequin as if it was a real patient in its own right, like the SimMan stations where you have to deal with an emergency or life-threatening scenario. So what is the scoring system when it comes to PLAB, or more accurately, what competencies are being assessed? So there are 3 domains which apply to every single station that you will come across. There's data gathering. It's actually data gathering and technical skills. So data gathering, clinical management, and then interpersonal skills. So data gathering will cover everything that you would do in a consultation to get information from the patient. That includes history, that includes interpreting any results that are given to you. That includes examining a patient or examining a model or a mannequin and interpreting the findings. That all comes under data gathering. Okay. Then you have clinical management, which is, of course, testing your not just your knowledge, but your application of knowledge. So we know now that you are in PLAB 2 that you have a sufficient level of knowledge to work as a FY2 in the NHS, which is the level of the PLAB 2 exam. However, what the PLAB 2 exam tests is, are you able to do the things with that knowledge that you need to do in real life scenarios? So can you formulate a differential diagnosis or a working diagnosis and then explain that to a patient in an appropriate manner? Are you able to do that? And at the same time, are you able to ensure that you don't just push your agenda the whole time? Are you able to remember that during your history taking, your data gathering, the patient was actually concerned, the patient was actually worried about something that that was bothering them, something about their symptoms, something going on at home, something that was happening in their life, and they mentioned that. Did you actually are you able to actually use that information and speak about it and relate it to the management? Are you actually able to marry the two agendas, the patient's agenda and your agenda, and are you able to go through, move that forward at the end of the consultation? So it's not just do you know 15 differential diagnoses of abdominal pain. That's not what's being tested. That's nowhere near what is being tested. What is being tested is, are you able to assess a patient presenting with abdominal pain in their own psychosocial context with their own worries, gather that data from the patient, use your clinical knowledge and your interpersonal skills, which we're coming to in a second, and then move both yourself and the patient forward together in how to manage it. That's what PLAB 2 tests. Finally, interpersonal skills, which you've already alluded to, but this is how you interact with the patient, the model, the mannequin throughout. Are you patient centered all of the time? Is your focus always about what is most important for the patient? Are you communicating with them in a way that's professionally appropriate? Are you a good listener? Not just are you hearing what they're saying, but are you listening to what they're saying? Are you picking up their cues? Are you reflecting back their concerns or their cues? And are you adjusting what you are speaking about in the consultation based on what's coming back from the patient? Or are you just reeling off a list of questions that you have memorized about abdominal pain or chest pain or any other kind of presentation? So the interpersonal skills, how you interact with that patient, is the most important part of the PLAB 2 exam. It makes up 50 to 60% of the marks, with clinical management making up 30 to 40%. Candidates worry about how PLAB 2 is assessed. I seem to have. Sorry, I'm just going to stop screen share and then share again because I seem to have an issue with my presentation. Okay. Okay, so candidates worry about, as most, as I did as a medical student and as a GP trainee and doing everything else, people worry about how exams are marked. So we'll just mention it briefly. It's you're assessed using what's called the borderline regression method. Essentially, just to summarize, it's a bit complicated, but just to summarize it, there isn't a set pass-fail mark until before the examination takes place. It all depends on how the group performs, and you're assessed based on your global rating. So whether you are a clear pass, a borderline pass, or a clear fail. And so the examiner will assess you. Obviously, they'll assess each particular domain, data gathering, clinical management, interpersonal skills, but then they'll give you an overall rating. And then what they do is they use computers to do a complicated statistical analysis of how the group did, and then set the pass or fail mark. So sometimes it might be higher, sometimes it might be lower. It's really not that important. It's not fixed. That's the main thing. And the other important thing to mention here is that it's not healthy and not very productive for you to focus on, what's the pass mark, what's the fail mark, because that won't help you. What you need to focus on is what we mention, what I'll mention in a couple of slides, which is ensuring that you perform consistently well in all the three domains. And even when you're faced with a scenario where you feel a bit lost in the station, you have learned the skills to be able to still get marks and pass that station. That's the most important thing. So anyway, the way it's marked, what the GMC tells us is the key implication is that it's fair. It will account for minor variations in exam difficulty. And you don't need a perfect score. You don't need to ace every station. You don't need to, you can fail some stations and still pass overall, but you just consistently need to perform above the borderline. So what does this mean for your preparation? As I said, you have to focus on performing consistently well, and you have to focus on mastering the skills that will give you the best chance of picking up the most marks. So, you obviously you want to perform at least at the clear pass level in most stations, and just try to be away from that borderline kind of mark. So what does this mean in practice for you? What other things are the examiners looking for? So they're looking for practitioners who are safe. Okay, primarily they're looking for people who are safe. Obviously, all the things we've mentioned, already, they're important as well, but they're looking for people who are safe. You don't miss critical steps. You don't miss red flags. You don't miss asking about red flag symptoms. You don't miss a potential cancer. You don't breach confidentiality. All of these kind of things. They look for for candidates who are patient-centered in their communication. So doctors keep saying patients, candidates who are empathetic, who can speak with clarity, who can not only, know what's going on medically, but be able to communicate that in a way that the patient understands what they are saying. And this comes back to the most important part of PLAB2, which is the communication skills, which we'll detail in a bit more in a few more slides. And they are looking for candidates who behave in a professional manner in line with GMC guidelines. Again, we'll break this down shortly. So you need to avoid clear fail moments. So what are clear fail moments? You mentioned some of them already: missing red flag symptoms, missing the need to refer somebody on a high suspicion of cancer pathway, or missing, or prescribing or intending to prescribe to somebody who's allergic to that drug, for example. So these kind of things. What other things are clear fail moments? So unethical, doing things unethically, or doing things that are out of line with what the GMC expects in terms of professionalism. So this might be, breaching confidentiality to a relative, or it might be, saying something inappropriate in a consultation, speaking to a patient inappropriately. These are the kind of things that you need to avoid in your PLAB2 stations. So there are some competencies. We've mentioned the 3 domains. Now, there are lots of competencies that are important for PLAB 2. It's not possible, of course, to go through all of them in 30 minutes and 40 minutes and to ensure you are now ready to pass your PLAB 2 exam. Not at all. What we can do is we can pick a select few, go into them, discuss them, explain some of the things that are important and explain how we can help with that. That's the kind of extent to what we can do in 30 to 40 minutes. But the skills that you require, as Dr. Skill mentioned, I was an OSCE examiner for 10 years. Examining OSCEs and sitting, performing in OSCEs is a high level skill. It takes lots and lots of practice, and not just practice, but it takes feedback from somebody who is more senior to you, more experienced than you, who has practiced in the system that you want to work in, and who can give you feedback on, how you are doing in relation to what examiners want. That's what's most important. It's not something really that you can have a high chance of success with if you if you try to do it, on your own. So what are some of the competencies that are important? So communication, we've mentioned, empathy and clarity. What do examiners want? They want patient-centered interactions. What that means is you're not just there and quite obviously not listening to what the patient is saying and reflecting back and not acknowledging what they're saying, not summarizing what they're saying. And you're just going through your list of questions that you've memorized for what you have to ask when somebody presents with a certain symptom. That is not what examiners want. Examiners want patient-centered interactions. They want structured conversations. What structured conversations means is that the way you consult, it flows, it makes some kind of sense, it's logical. You cover things like ideas, concerns, expectations, as well as covering your own, kind of medical agenda in the consultation. They expect you to start with data gathering, then proceed to to clinical management and negotiation and these kind of things. They want a holistic approach to stations. What that means is if somebody is presenting with abdominal pain, then they are not just presenting with abdominal pain in a vacuum. They are a real person who who perhaps lives with alone or with a family. They have other things that can impact on their symptoms, and that their symptoms can impact, like they might work, or maybe they don't work. But you have to explore the psychosocial context of the patient and place that patient in a particular context when you are assessing and trying to manage their symptoms. That's what it means to approach stations holistically. What else are they looking for? They're looking for non-verbal skills. They're looking for not just robotically, kind of nodding and stuff, but they're looking for signs that you are actually engaged in a real, genuine, clinical consultation, conversation with this patient. You're adopting an appropriate tone, you're sitting appropriately, you're reflecting the body language of the patient, you're picking up their cues, you're reflecting. If you're not able to deal with something at the time, you're signposting it. You're saying, "Thank you for mentioning that you're concerned about X. Let me just finish my line of questioning, and then I'll come back to it." You're doing things like that to show a high level of competency in communication skills. So certain things, if we look at specifically, so empathy, how can you demonstrate empathy? Because empathy is an emotion, but how do you demonstrate it? You have to verbalize it, otherwise the examiner doesn't know that you're empathetic, so you won't get the marks. So you have to say things like, "I understand this must be worrying for you," or "It sounds like this pain has been really frustrating." But again, not memorizing stock phrases, but making these feel part of a natural conversation. Clarity are things like, avoiding jargon, avoiding terms that patients won't understand initially, and summarizing things. So, summarizing helps you as the clinician because it helps you crystallize your thoughts, but it also helps you make sure that you haven't missed anything. So saying something like, so you've had headaches for 2 weeks, which are worse in the morning. Is that correct? And again, structure is important, not scripts, structure. So scripted consultations are inflexible, you don't listen properly, you're just regurgitating your thoughts and pretending you are listening to the patient. That's not what will get you PLAB to success. You have to be structured but responsive. So you have to listen, respond, and you have to work towards a joint understanding in that consultation with the patient. What kind of things will make these skills difficult for you? Rushing through history taking, just being worried about, I've got to ask about all these symptoms, I've got to get through it. One-way conversations with a purely medical agenda, it's not a two-way conversation, ignoring cues. And as I've already said, to give you a high chance of success with these kind of skills, you have to practice whilst being observed by people who can teach you, who can pick up your good points, reinforce them, and who can pick up the things where you're lacking and then give you advice on how to improve them. What other kind of things are the examiners looking for? So they're also looking for evidence of your clinical reasoning and how you're applying that knowledge. What do they want? They want logical, safe decisions, even if they're not perfect. They don't necessarily want you to know, specifically, which drug for how long at what dose. Those kind of things are important as well, but they are not as important as some of the things that we have mentioned. So, even if you don't remember exactly the dosing of the drug, it doesn't matter. You won't necessarily fail that station. What they want is they want to know that you are safe and that you have a basic level of competency, which is what is expected of an FY2. They want to make sure that you are able to prioritize things. If somebody comes into the consultation and they say, "Oh, doc, I've got a couple of things I want to speak to you about. One is, um, I just need this thing signing by you. It's extremely important. I need my sick note. I need my fit note doing really, really important because it's about to run out and I've got to leave." But they also mentioned that they're having a concerning symptom. So what you have to do is you have to ensure that you are able to demonstrate you can prioritize. So you can manage their expectation about the fit note while at the same time making them realize that actually it's more important right now that we speak about your chest pain or your lump or whatever else they've mentioned. They also want you to be able to share justification for your actions, not only because it makes it clear to the examiner what you're doing and why, but also because it makes things clearer for a patient. And you can't take a patient with you in that consultation journey unless they understand why you are doing what you're doing. So how can you demonstrate this? Have a structured approach in terms of clinical reasoning. Ask questions in a structured way. So open initially, listen initially. We talk about the golden minute at the beginning and the golden minute towards the end of the consultation. So the golden minute in the beginning is you ask an open question and then you zip it for up to a minute or as long as you feel able to. Obviously, you're under pressure. But because they will give you lots of the information you need, and then you can then proceed with the kind of things you feel you need to ask. Other things as well, like making sure you complete a line of questioning before moving on, rather than jumping from here to there and back and forward. That's unstructured and that doesn't flow well. And obviously checking things like red flags. Examination, obviously you would expect to have to be able to explain the steps that you are doing and why. In terms of management, you need to be able to suggest sensible, safe next steps and explain that clearly to the patient. They don't expect you to have a secondary, a specialist level of knowledge for how angina is going to be managed. They just expect you to do what's appropriate but in a patient-centered way, in a way that the patient can understand. for an FY2 level. What are the common mistakes? We've mentioned some of these already. Huge symptom checklists, missing critical differentials, over investigating is another thing. Not having good clinical reasoning and not being able to arrive at a likely diagnosis of a simple tension headache and being unsure and then saying I need to order an MRI of the head, for example. So how can you improve these kind of things? You need to practice with trained simulators. And I would add a qualifying point here, trained simulators with British accents or with with accents that you find that are common in the UK that are likely to reflect the type of patients you will get in the NHS and the simulated patients you will get in the PLAB2 exam. With all due respect, there's not much point in only practicing. Obviously, practicing with peers is important, but there's not much point practicing only with your peers because you won't get that exposure to language, to getting used to accents and the nuances of communication that are really important that we mention shortly. Okay, the third essential competency which we want to dive into a little bit today is professionalism, which is ethics and some of the GMC's guidelines on this. So again, these documents are huge. The awareness and the understanding that you need of these is quite deep. It's not something we can do in a short webinar, but we can give you a flavor of it. Most important thing is GMC's good medical practice. It's a huge it's a huge resource that's available on the GMC website. You can Google it, you can find it. Obviously, they don't expect you to memorize it, but they expect you to have an awareness and an understanding of it and be able to apply these guidelines in practice in your consultations. You need to make decisions ethically. You need to handle conflict professionally, whether that's conflict with a patient, conflict with a colleague, whether it's conflict potentially with another situation that comes up in the scenario, or you need to be able to even do things like admitting mistakes. So apologizing or saying sorry to a patient is not incorrect, it's not wrong, doesn't mean you're taking the blame, and all these kind of things. These are kind of things that you have to get an understanding of and be able to practice and get a feel of how these conversations actually pan out. Teamwork is extremely important. It's one of the things that the GMC focuses on heavily in the guidelines. But teamwork in a way that's practiced in the NHS. How you communicate with colleagues, how you refer appropriately, how you don't shift blame, all these kind of things. So how can you demonstrate, your awareness of ethics and the GMC guidelines? So you have to make it clear, obviously, in your explanations, and you have to make it clear why. So you can, if you're, let's say you have a station where you're about to explain colonoscopy to the patient. So how or you're about to consent a patient for colonoscopy, you need to word things correctly. You need to say, I'll explain the potential risks and benefits of the procedure before you decide whether you're happy to go ahead with it. You have to don't necessarily have to spell out that you're speaking, that you understand what consent is, but you have to make it come across in your explanations. Confidentiality is another example. Being clear, being unambiguous, and saying like, I'm sorry, I'm very sorry, but I can't discuss your daughter's results with you without her permission. And then obviously there'll be some challenge to that, and you have to be able to hold your own. You have to be able to explain why you can't do that, and what principles they are based on. This is how you can demonstrate these kind of things. So common mistakes when it comes to professionalism, ethics, GMC guidance is not being familiar with the GMC's good medical practice document. You do have to be familiar with this. You do have to immerse yourself in what it talks about, and try to practice that whenever you try to allow it to come into your consultations. Obvious other errors that we've already mentioned, like breaching confidentiality or being defensive, blaming other people for errors, or not being open and honest about things that have gone wrong, which is part and parcel of normal medical practice. So that's just a table. It just summarizes what we've mentioned. Some of the things for these three particular competencies. What are the key actions we've mentioned? What are the things that we have mentioned that you should be trying to avoid? I think to summarize what the PLAB2 stations test, this is I think is a good summary. Would this doctor be safe to work in the NHS? What that means is that the PLAB2 exam doesn't look for perfection. It doesn't look for outstanding medical knowledge. It doesn't look for perhaps for some of the other things that you might expect in postgraduate exams. Doesn't look for that. What it looks for a doctor who is able to communicate well, who is able to understand the patient's perspective, while at the same time getting across their own perspective, and then is able to do that safely, competently, and do it in a way that means that both the doctor and the patient are at the same. They don't have to always, be 100% agreed with what you're suggesting or sure, but at least that you've made progress in moving that patient on in that consultation, and you're taking them along with you in your journey. So as we said, you've got to focus on things like safety. You've got to focus on building patient trust, and you've got to ensure that you are, in the way you communicate, it's obvious that you are thinking logically. Like I said, even if you feel like your knowledge is limited in a particular scenario, doesn't necessarily mean that you will fail that station. You can still pass that station. You can still comfortably pass that station with the right training. So what are the common, I'll try and speed up now. What are the common challenges for IMGs? There are many. We're going to focus on a few, just briefly go through some of them. There's cultural challenges in relation to NHS norms, systems, hierarchy, the way of doing things. There are language challenges in terms of, not being a native English speaker, understanding accents, adopting the correct tone, and the nuances of communication that come naturally when you are a native speaker, but are difficult when you are not. Then there are things like OSCE, being unfamiliar with this particular type of OSCEs and then managing time. So cultural norms in terms of the NHS, why does it matter? Obviously, you're going to work in the NHS system. You have to behave and speak and converse and think in a particular way. And this is why it's important to try to immerse yourself in that kind of environment, in them kind of resources, and with that kind of preparation. Hierarchy and teamwork, escalating concerns appropriately, always ensuring that the patient autonomy comes first, shared decision making, but the final say is always with the patient, as long as capacity isn't an issue. Politeness and tone is one of the most challenging ones, particularly in terms of tone, because you have to practice using collaborative language. And as I said earlier, you can only do that really if you're practicing with people who will speak in that way, and then you are being observed by people who who can see what's happening and who can give you advice. Language, you can fail stations despite being clinically sound. That is guaranteed. You might ask all the right questions. You might tick all the boxes in terms of your clinical reasoning and your differential and your clinical management. But if your communication isn't up to scratch, you will fail that station. That obviously means all aspects of communication. That's listening, that's speaking, that's body language. That's the skills that we will teach you, how to signpost, how to summarize, how to reflect, all of these kind of things. You will fail stations if your communication skills are not up to scratch. And even fluent English speakers can struggle with communication nuances. That's why it's extremely important to make sure you are practicing with people who can speak in that way, and will speak in the way that the simulated patients will in your station. So, what kind of things, simple things can you do? Always picking clarity over complexity, always using simple terms. Your tone, it has to be polite, it has to be professional. You've got to speak slowly and clearly. And your open-ended questions. I keep coming back to this, but it's because it's one of the most important skills in history taking is being able to listen. Are you able to ask a question and then listen to the answer? Actually, not just hear, but listen to what the patient's saying and then use that to move forward, not just move forward in what's going through your own mind. Most people, when they listen, they are thinking of their next sentence or their next question or what they're going to say. That's, if you do that, then you're not going to hear what the patient's saying. So we've mentioned lots of these things already, using jargon, talking too fast, too many medical terms, missing cues, all of these kind of things will really damage your performance in these stations. How can you best prepare for this? It's a practical exam. You've got to practice, 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 but whilst being observed by an expert. Practice for the sake of practice is not going to necessarily improve your performance. You've got to be observed by somebody who knows what they are doing and who can advise you correctly. Being unfamiliar with OSCEs, so obviously most people will have done OSCEs or OSCE style examinations, but they might not have done one where they only have 8 minutes. Or they have this particular format, where lots of different types of skills are being tested or communication skills are being tested. So what can you do? Understand the types of stations, obviously, prepare for them, practice them, but mock OSCEs are extremely important. Having exam condition mocks are extremely important. And being able to practice with somebody who observes you, who can mark your performance, who can show you where you need to improve, and even give you a structure in how to improve, not just say you didn't ask this or you didn't do this or you didn't do that, but actually improve the way you conducted that consultation. Time, is one of the main problems, and even the summary that you read at the beginning, that if you don't understand what exactly is being asked of you, then you're gonna miss the important tasks in that station. Time management, we mentioned this already. It's strictly timed, it's high pressured. So what you have to do is you have to try to split your consultation into roughly 8 minutes. And the best way to do that is history taking 3 to 4 minutes. Actually, this more more accurately, it should be data gathering 4 minutes, and then management 4 minutes. So this can vary depending on the type of station, what procedure it is, what symptoms there are, what examination you have to do. But you have to, you have to at least give yourself 3 minutes at the end to actually have a discussion with the patient. And we've mentioned already, got to practice in a timed manner. So common mistakes that cause issues with time management: spending too long on irrelevant details. So you can be overly medical. You can also be overly holistic as well. I mean, taking a full social history in somebody who's presenting with an acute abdomen is clearly not relevant. So you have to know how much time you are giving to each portion of the data gathering. Silent pauses are a real problem as well. So even if you are thinking, you should still be able to um, you should be able to verbalize something in them spaces, maybe summarize, which is a good way of helping you clear your thoughts as well, or asking the patient, to share some other things. But just sitting there silently is just killing time. Okay, so to summarize, PLAB2 is about being safe. It's about being patient-centered. It's about communicating well, but it's not about perfection, particularly when it comes to the clinical side of things. So you've got to focus on your communication skills. You've got to ensure even that part that is small, which is the clinical part, even you have to make sure that that's sound as well, that your clinical reasoning is sound. This is something, clinical reasoning, something that should be, it should be not perfected, because you never perfect it, but it should be at a high level, even if you are, yeah, because especially if you've practiced for a long period of time, you should be very skilled at taking a focused history and eliciting really important pieces of information, and time discipline, as we've mentioned. Okay, so I think we definitely have gone over, as always. But I just want to just share this. This is the kind of, obviously it's easy for us to pick chest discomfort, but this is the exact type of wording you will face in a PLAB2 scenario. Just to give you an example, you're an FY2 in A&E. Mr. Smith, 58-year-old male, is presenting complaining of chest discomfort. Assess the patient and proceed as appropriate. It's that brief, it's that simple, and it's that vague. You won't get, despite what you might see in practice cases, you won't get lots of information. You won't get any information on a history, duration, type of discomfort. You might get something else here, like an ECG has been done and is available for you in the station to view, etc. But this is a typical kind of scenario. In this kind of scenario, you would be expected to go in, greet the patient, introduce yourself, check their details, take a history, focused history, as well as placing them in the psychosocial context, understanding what they do, who do they live with, do they smoke, do they drink alcohol, all of these kind of things. Examining the patient, perhaps even looking at an ECG, and then moving forward. All of that in 8 minutes. So as you can see, it's a complicated task in a short period of time. The final thing I'm going to mention is why consider our courses over anybody else. And then I'll end the presentation, and then we'll be available for any questions. First and foremost, our courses are prepared and delivered by OSCE experts, so led by myself. We've dealt with OSCEs, we've examined OSCEs for many years, so we know exactly the kind of things the examiners will be looking for. Second thing is we focus on building skills, not scripts. So you will be building skills, the communication skills, the clinical reasoning skills, and the negotiating skills that you need to be able to do well in these stations and in your future NHS career. So we build skills in our courses so that you, even if you have no clue, this is obviously unlikely, but even if you have no clue about this particular medical problem, you can still pass that station. That's the kind of level of skill we aim at building. In our courses, the face-to-face courses, of course, you will get daily supervised practice with individual feedback. So we're not the type of academy that will just say, okay, guys, here you go, here's all the models and mannequins, here's some case scenarios, go away and entertain yourself for 3 to 4 hours. Doesn't work like that. You'll be supervised and you will get feedback, which will improve your performance. There's a range of options available, face-to-face courses, which are 2 day, 5 day, 10 day, and we have our online course as well, which can either help you prepare so that when you come to the face-to-face course, you've already got some of the knowledge and some of the skills and you can hone them in the face-to-face course, or it can give you an additional kind of additional element to your skills if you are already doing a face-to-face course with somebody else. And the final thing is prepare. We will let you prepare with us till you pass. So if you pay for our 10-day course, 2 day course, 5 day course, and you are unfortunate enough to not clear your PLAB exam, which I will say is extremely unlikely because our candidates are very prepared. But if you are in that unfortunate scenario, you can come back, you can attend that course as many times as you need until you pass your exam, and that's our promise. And the rest I'm going to hand back to Dr. Shakil and hopefully be available for any questions. Apologies for the longer time it's taken. It's very difficult to speak about these kind of things in just 30 minutes. So back to you, Dr.
Okay.
Shakil.
Thank you so much, Dr. Omar. That was very comprehensive detail for any international medical graduate that need to know about the PLAB too. So we open for questions. Anybody has got any questions, please, either you can put in the chat box or just unmute yourself and ask us questions. We are here to answer all sort of your questions. Anyone has got any questions? I think everybody understood very well everything about the PLAB too. They know everything. But we're here for your help. You have seen, feel free. I've shared some links in the chat box. Feel free to go on our website, hivemedicalacademy.com, and you'll get everything. Our PLAB 2 batches, first batch is in August. Then we have got every month PLAB 2 batches going on. For the PLAB 1, you can get all the details from the website. Any questions, anything, our numbers are there. And if you're also looking for the clinical attachment, we have got solid partnership with the different surgeries, hospitals, and we facilitate our doctors for the clinical attachment, and we try to get their attachment well before the PLAB 2 exam because that will be very helpful because they would know the NHS and they would have interaction with the real patients before attempting the PLAB 2. Please do visit our website. Any questions, get back to us. I think we will end here because there are no questions. Once again, thank you so much, everyone, for making effort to attending this webinar. We will be doing some more webinars about the PLAB 2, where we'll be discussing just the clinical station and scenarios. And we'll try to keep it like, maximum 30 minutes where you can know about, we could discuss our two scenarios, like 8 minutes, 8 minutes, and then we'll have the feedback about it. But that will be very, very interactive. So keep an eye on our website, our events and webinars pages, and we'll see you soon. Thank you so much, Dr. Umar. Thank you so much, Asma, and thank you so much, everyone, for making effort to attending this webinar. And see you soon. Thank you and bye bye.
Thank you, everyone. Any questions, just drop us a WhatsApp or an email. Do explore our PLAB2 free trial, which you just have to visit the website, put in your name, email number, and you get access to a limited selection of our resources for 72 hours, just to give you a feel of what our courses are like. Thank you very much for